Good afternoon, everyone. Today is Tuesday, April 13th, 2021, and we've convened the Board of Health for the New York City Department of Health and Mental Hygiene. It is 3:01 p.m., and I will call this meeting to order. So to begin, I'll conduct roll call. Are the following members present? When I say your name, please unmute and say here. Joel Foreman.
Here.
Karen Redlener.
Here.
Lynn Richardson.
Here.
Pamela Breyer.
Here.
Sixto Caro.
Here.
Susan Klitzman.
Here.
Mitchell Katz. I don't hear Dr. Katz. And Rosa Gill. And I don't hear Ms. Gill either. I'm going to start with just some introductory remarks about the development of the day, and we'll circle back to see if our two colleagues have joined us by the end of those 2 minutes. So before getting started with the business for today's Board of Health meeting, I wanted to address a topic that I'm sure is on everyone's mind from the news today regarding the Johnson & Johnson vaccine. So a brief update. This morning, as you may know, federal partners, the FDA and the CDC, sent out an alert about a small number of rare serious adverse events involving the Johnson & Johnson vaccine, also known as the Janssen vaccine. We're communicating about this both to the public, but also directly to all COVID-19 vaccine providers. What we know thus far is that the cases being reviewed by the FDA and the CDC involve a type of blood clot known as cerebral venous sinus thrombosis, or CVST, that was seen in combination with low levels of blood platelets known as thrombocytopenia. There were 6.8 million doses of Johnson & Johnson that have been administered nationally, and 6 of these adverse events of the CVST have been reported thus far. So while these events are extremely rare, out of an abundance of caution, the city is pausing the administration of the Johnson & Johnson vaccine today, and we're reviewing operations for the coming days as well. What that means is that for patients who are due to receive the vaccine, those appointments will either be shifted to another type of vaccine or will be rescheduled. And we are continuing to administer the Pfizer and Moderna vaccines here in New York City. I want to emphasize that this is the vaccine system working exactly as it should. Events are reported nationally, and the actions that are being taken today reflect how seriously we take signals from that warning system. And healthcare providers, including some of you, are asked to report adverse events to the vaccine adverse event reporting system. But the bottom line remains that continuing our COVID vaccination efforts remains an urgent priority, one of the most important ways that we can protect New Yorkers, as you know. And so we will proceed with administering the Pfizer and the Moderna vaccines to beat back the COVID-19 pandemic. We'll follow the developments from the CDC and the FDA as they conduct their investigations for the Johnson & Johnson vaccine. We'll navigate through this both with respect to the short-term implications, but are also thinking about the longer-term implications with respect to vaccine confidence efforts as well. So I wanted to provide that brief update as I know it's on everyone's mind. And unfortunately, we don't have time for questions at this moment because I want to ensure that we cover today's agenda topic, but I did want to spend a few minutes because I'm sure that it was on everyone's mind. So with that, why don't we get started with the order of business. Let me just circle back to our two colleagues and complete the roll call. When I say your name, please say here if you are here. Mitchell Katz.
Here.
And Rosa Gill.
Here.
Thank you both so much and welcome. So before we discuss the items on today's agenda, let's please start with approval of the minutes from the January 25th meeting, which I know have been circulated to you. Are there any corrections to the minutes from the January 25th meeting?
I have one small technical one. This is Joel.
Please go ahead, Dr. Foreman.
Page 26, line 2. I believe it should read HL7 web service, not HO7. It's a standard for data interchange. That's it.
Thank you.
Thank you so much, and you are correct. Are there any other corrections to the minutes?
I move adoption.
Wonderful, thank you. So I have a motion to approve the minutes as amended. I heard that from Pam. And do I have a second?
Rosa, second.
Thank you. I didn't catch who said that. I'm sorry. Could you just repeat?
Rosa,
Rosa, thank you so much for the second. All those in favor?
aye.
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 Aye. Aye. Aye.
Okay, any opposed? Hearing none, the minutes from the January 25th meeting are approved as amended. We'll move to the first item on our agenda, which is our sole item on today's agenda. It's the proposed resolution to amend Article 173, hazardous substances of the New York City Health Code regarding lead-based paint. And our presenter is Christopher DeAndrea, who serves as our Assistant Commissioner for Environmental Disease and Injury Prevention. Thank you, Christopher. Welcome. And I will now turn this meeting over to Christopher.
Thank you, Commissioner. Hello, Board. I'm also joined here with Andrew Fasciano, who's the Executive Director of the Healthy Homes Program. Also in the room is our Deputy Commissioner, Corinne Schiff. So let me get started. So just to review, in 2019, thanks to the Board, Article 173 was amended to reduce the child blood lead level for mandatory department investigations from 15 to 5 micrograms per deciliter or higher. And additionally, the action level for lead content in paint was lowered from 1 to 0.5 milligrams per centimeter squared for inspections of the dwellings of children with elevated blood lead levels, created a new, what we called an unsafe lead paint standard. Since those changes, Healthy Homes Program data has shown an increase in the children eligible to receive interventions from about 300 per year to over 3,000 per year. So about more than a 10-fold increase. Also, there was an increase in the proportion of homes that were abated as a result of the application of the unsafe lead paint standard. So it went from about 70% of the homes inspected to about 80% of the homes inspected that had an abatement, which reflects about a 15% increase in violations. Next slide, please. So just to go over some recent events, last summer we received a petition to further amend Article 173 to make explicit that the department investigates at the new blood lead level to include inspections of any location where a child regularly spends significant time. Also, it was requested that the unsafe lead paint standard be extended to non-dwellings and further clarified that the department has authority to order the abatement or remediation of lead-based paint and dust in locations occupied by children under the age of 6. In March, the City Council adopted some new amendments to Local Law 1 that require the department to investigate at the new blood lead level to include inspections of any locations where the child regularly spends significant time. And it also extends the unsafe lead paint standard to childcare programs regulated by the department when part of an investigation beginning in 2022. So we're here to propose amending the health code to make changes that would not only further promote child health, but also reflect our existing practices and align with the new local legislation and be consistent with the petitioner's requests. Next slide. So specifically, with regards to supplemental addresses, we're proposing to add an amendment. So the department is suggesting that we will investigate, as may be necessary, the dwelling unit and any supplemental address for children under the age of 18 with a blood lead level of 5 micrograms per deciliter or higher. Additionally, we want to add a definition of supplemental address to state that where we have a child with an elevated blood lead level of 5 or higher, and that child spends 5 or more hours per week at a location, that would be considered a supplemental address. And just as a note, this is more protective than the administrative code requirement to inspect locations where children spend 10 or more hours per week. We also looking to remove an outdated reference to the supplemental address investigations in the definition of dwelling, which limited the department to the old action level of 15 micrograms per deciliter. And so these changes would align the health code with our current practices. Next slide. We're also proposing to clarify the scope of our authority to make explicit that when we find a lead-based paint or dust with an elevated lead content that may be creating a danger to the health of children under the age of 6, we may order the abatement or remediation of the condition. It would also include, in addition to dwellings, premises such as schools, child care facilities, recreational facilities. Again, this would align the health code with our current practice. Next slide, please. And so just a little bit more about the changes to the local law. The board's authority to require the more protective unsafe lead paint action level of 0.5 milligrams per centimeter squared was limited to dwellings only in cases where we were investigating a child with an elevated blood lead level. This new legislation allows the board to apply this more protective standard to department inspections of supplemental addresses regulated under Health Code Articles 43 and 47, which are child care facilities, beginning in late 2022. So the proposed amendment would do just that, add child care facilities regulated by the department to the types of locations in the definition of unsafe lead paint hazard beginning in October of 2022. Next slide, please. Additionally, we're asking to remove some expiring lead dust action levels. These provisions expire as of June 1st, 2021. The new more protective standards take hold that day, June 1st, 2021, regardless of the actions here today. As of June 2021, for floors, it will be 5 micrograms of lead per square foot, windowsills 40 micrograms of lead per square foot, and window wells would remain the same at 100 micrograms of lead per square foot. Next slide. This is a summary and a timeline just to clarify where we have been and where we hope to go. So in 2019, the board adopted new lead provisions after the City Council updated Local Law 1. We received the petition, as mentioned earlier, in August of 2020. In March, the City Council made changes to Local Law 1. Here we are in April, giving our presentation. And we hope that there'll be some hearings on these departmental proposals. Hopefully in May. We don't have a definitive timeline, obviously, at this time, considering where we are with the pandemic. And in June, if everything goes well, we would then meet with the board again, hopefully to consider adoption of these measures. Again, the lead dust levels adopted in 2019 will take effect automatically in June, as of June 1st. Next slide, please. So in summary, specifically our proposal, we're asking the board to approve for publication and open a public comment period the following amendments. Mandate the department to inspect any location where a child under 18 years of age with a blood level of 5 micrograms per deciliter or higher spends at least 5 hours per week. Make explicit the department's authority to require abatement or remediation of lead-based paint or dust in settings likely to be frequented by children. Apply the unsafe lead paint standard in facilities regulated under Articles 43 and 47 when part of departmental investigations of a child with an elevated blood level, and remove expiring provisions regarding lead dust action levels that won't be applicable as of June 1st, 2020. Next slide, please. So one other thing I wanted to mention is last year, 2020, marked the 50th anniversary of the Childhood Lead Poisoning Prevention Program, which is now the Healthy Homes Program. Unfortunately, we were not able to celebrate last year, but hopefully at some point this year, we'll be able to take on those celebrations. So I open it up to the board for any questions you might have.
Thank you so much, Christopher, for leading us through that presentation. And yes, we'll open it up to the board for questions. You can either use the raise hand function in Zoom or just raise your hand on the screen and I will call on you. I see Karen's hand first. Go ahead, Karen, please.
Thank you, Commissioner, and thank you, Christopher, for that presentation. I really, we've been through a lot of conversations about the issue of lead and the risks to children, and I'm happy to see that we're continuing to update our regulations, especially for consistency. So I read through the documents and I have a couple of questions about language, really just consistency relative to the age of 6 versus the age of 18. And I know that we have approved an investigation into the dwelling and now other addresses for children with lead levels over 5 who are under the age of 18. And that is clear in the new language in part 4, paragraph 4. But then there are a couple of other places where when we add the language about other addresses, childcare services, schools, and recreational facilities, it says primarily used or occupied by children under the age of 6. So I'm just kind of trying to understand the protocol. Let's say a child is 9 years old and has a lead level of 5, you would investigate the dwelling, and then you may investigate another location where he spends 5 hours or more, like a recreational facility or a school. Is that still likely, or does the age, designated in the paragraphs, does that matter? That one says likely used by children under the age of 6.
Where we have a child, my understanding is where we have a child with an elevated blood level as part of one of our investigations, it's up to the age of 18 where we can inspect supplemental addresses, primary addresses, dwellings, and non-dwellings.
Okay, that makes sense. I'm just wondering if the language, let's say in paragraph 1, where it says generally, the language that was added says, other addresses where childcare services, schools, or recreational facilities primarily used by children under the age of 6. So I'm just wondering if that's confusing. It could be a recreational facility that's used by children up to the age of 12. Does that matter? Do we need to put in 6? Under the age of 6? I know that the younger children are, tend to be the more at risk due to their developmental stages, but I just don't want this to be confusing in the future.
Yeah, I understand it. It seems confusing to me as well. I think I would probably need to follow up on that to just ensure that isn't a limitation on us.
Right.
So I would need to follow up and check in with our.
Okay. Yeah, I just, before we put it out for commentary, it's likely that you might get commentary about that. And if it's something that we don't want to confuse people about, might as well do it beforehand, but just a thought. And in that same paragraph, just to focus on some detail, paragraph number 1, where it says generally, right after the added language, it says, or concentrations of lead in the paint on the exterior of a dwelling that may be creating danger to health. And maybe we should change that from dwelling to, such premises, or a word that includes the other addresses.
Thank you. That would be more comprehensive in language and scope. That's something I can bring back and we can consider making a change.
Okay, thank you.
Thank you very much, Karen. I saw Lynn Richardson's hand up next, and then I have Joel and Susan in the queue as well. But first, over to you, Dr. Richardson.
Thank you, Dr. Chokshi. So I just want to make sure I understand that how much of this, or is it all of this, really is driven by the need for us to harmonize with the recent legislation passed by the City Council? Is all of this simply to harmonize with that legislation? Or are there parts of this that are actually being put forward by the department? I just want to make sure I'm clear.
Christopher, I can start on this one and then please add on. It's an important question. The way that I would describe it is this represents a convergence in terms of some things that the department was already doing in our operational practice that are now being codified in the health code. Number one. Number two, the petition that we had received last year that proposed several of these changes as well. And then finally, the City Council law that was just recently passed. All of them are pointing in the same direction. And so the proposed amendments encompass those three coming together. Christopher, please add anything that you'd like in terms of commentary.
Well, thanks, Commissioner. I think that really sums it up. It really is kind of a harmonious convergence of those three aspects.
And if I may just follow up, so there is, as someone said, a long history of dual oversight of this issue of lead by the department and the City Council. Were the new standards that were put forth in the City Council legislation, were these all standards that the department supported? I'm sorry, I did not follow this legislative process when it was happening, so I don't know if the department took a position.
Please go ahead.
Yes, we support what the City Council put forth.
Okay, thank you.
Thank you.
Dr. Foreman.
Thanks very much, Dr. Chachi, and thank you for the presentation. I wanted to support what Karen said, and I had a couple other clarifying questions around those two key paragraphs. One is around the use of the word primarily in reference to, say, recreational facilities. And I wondered if that word, which is in there twice in paragraph 1, is necessary. We don't really define what that means. And the first one is primarily for children under the age of 6. And, when you get to places like recreational facilities, they can be used by people of many different ages. What is primarily? 10% of the time, 30% of the time? Does it matter at all? If it's used by children in that age group, maybe we don't need that word at all. So I would propose considering dropping that in the 2 instances in paragraph 1, if there's no reason not to do that. And then I had a second sort of question, which is that in the first paragraph, which is refers apparently to me to dwellings, it says the department may, in cases it deems essential, order an abatement. Whereas in the second, sorry, that's the generally paragraph. In the second paragraph about a dwelling, it says the department shall order the abatement. And those two words have very different meanings. One gives the department an option. The other one reflects an obligation. And I'm wondering if you could explain that to me and why those are different there.
So in the first instance, it was may in premises, and in the second, it is shall in dwellings, just to repeat. Right, so in dwellings, so premises can be a wide range of facilities and serving. So for example, in a high school, we have an older population. Doing a full abatement of a small area where we have chipping and peeling paint that was discovered as part of our investigation, but is not even thought to be the primary means of exposure. The remediation there might make more sense, and having some latitude would, I think, be beneficial with regards to resources and what's needed. And dwellings is a little bit more sensitive. So I think that is probably where we're coming from on the distinguishment.
Yeah, the first paragraph includes everything, right? And the first paragraph, the generally paragraph, includes dwelling, supplemental address, or other premises, such premises including but not limited to, and then it includes schools and childcare settings and recreational facilities. And for that one, it's at the discretion of the department. But yet it also includes dwelling, so it's a little confusing. Paragraph 2 is exclusively about dwellings, and carries the shall word, which would imply that it is an obligation.
Right. So that, I think it helps to clarify, since it was all kind of mushed together in that first section.
Any comment on the use of the word primary? Sorry, primarily.
I see where you're coming from with that, and I would have to take that back and consider. I could consider maybe revising that, dropping it as you suggested, but I would need to discuss that a little bit further. Thank you.
Okay, thanks so much.
Thank you, Dr. Foreman. And now to Dr. Klitzman. I know this is a topic that is near and dear to your heart.
Very near and dear to my heart. Well, good afternoon, and thank you, Chris, for the comprehensive presentation. I also want to just start by commending the department for its continued progress and commitment to protecting children from lead hazards, and really continuing to be on the cutting edge. And not only has the department had a lead poisoning prevention program for more than 50 years, but the Board of Health for more than 60 years has identified lead-based paint as a hazard. So we, the board, have been a very committed partner in this important public health preventable challenge. So I have a few questions. The first one is, can you say a little bit more about the magnitude of lead hazards in supplemental addresses where there is a child with elevated blood lead levels? As you mentioned, it has been a practice for quite a long time to inspect any premise where a child with an elevated blood lead level spends a significant amount of time. So outside of their primary residence, how often, what percent of the time approximately do you find lead hazards in those supplemental addresses such as daycare, schools, and recreational centers?
Thank you. I think what I would do is bring in Andrew Fasciano. He might have a little bit more detailed information on those specifics. I know we don't have them at hand, but he might have a sense of what those numbers could be. Andrew, are you there?
I am here. Good afternoon, everybody. Related to supplemental address inspections, I can speak most competently about supplemental addresses where the child, where it's considered a dwelling, so like a grandmother's house or a babysitter's house. And for those addresses, we do see a similar proportion of hazards identified. Excuse me. Whereas for childcare settings such as schools or other places, we don't see the same proportion of hazards identified, in large part because of the age of those structures. A lot of those are newer construction, including schools, and don't have a similar paint history as you would see for addresses that are just consistent with the old housing stock in New York City. But as we move forward, I think we'll have more information on as we do more inspections of more facilities, because as you know that we're focusing on a blood level of 15 or greater until 2019. We'll have more information on whether we see these supplemental addresses as being as significant as a risk or having the same risk profile as other supplemental addresses. But I can say with just confidence that dwellings associated with children with EBLs that are classified as supplemental addresses have a similar number of pain hazards.
Okay, well, I know you've been associated with the program for a long time, so I know you have a long history and would know. What I hear you saying is that the occurrence of lead hazards in non-residential supplemental addresses is pretty low, correct?
It's
much lower
income.
than in dwellings. Would it be possible, would it be feasible to, bring back to the board when we consider these changes, a more quantitative assessment of the magnitude of the risk?
We could definitely show proportion, like the proportion with positives, whether or not we can accurately compare the number of positives or the number of surfaces would be considered lead-based paint. I'm not sure that we'd be able to do that by the
not surfaces, but just to give a sense, the relative risk of what's the risk of the dwelling versus some of these non-dwelling settings, if it's feasible.
Yes, so yes, we can do that. And so for us, it will be generally dwellings versus childcare centers versus
correct. Yes, that would be helpful just to give a sense of the relative risk of what we're talking about here.
Sure.
And do you know, I see that recreational centers, do you know off the top of your head, has the department ever identified a lead hazard in a recreational center where associated with a child with elevated blood levels?
So like we're using the term recreational center quite broadly. So a place such as like a library, where a reading room in a space that wouldn't traditionally be associated with childcare would be considered a recreational center for us. So for those are typically rare that we do investigations in those settings, but there are our investigations are guided by the information provided by parents on where this child spends at least 5 hours per week. So they will take us to these non-traditional settings that where children are congregating. So that's where, but again, those are for the most part very rare, those investigations, but we just want to have the authority to go there if we need to, given our desire to address all the potential risk factors and exposure sources for a child with an EBL.
Okay, thank you. And my last question is, can you give us a sense of when you do find a lead hazard in a non-dwelling, a child care center or a school or recreational center, how you work with the owner or the tenant of that property to address the hazard, and will these changes to the health code, are you planning any changes in how you plan to enforce or oversee the abatement of lead hazards in non-dwelling settings?
Sorry about that. So we would issue an order to the building owner. So if it was like a commercial childcare center in like a mixed use building, we would still issue an order to the building owner to address those issues. And we would monitor the progress in complying with our order to abate or remediate surfaces, similar to how we would do it for any other address. And in instances where we would have to, we would work with our Bureau of Child Care program to help facilitate either access or compliance with our order. Traditionally, when it came to Department of Education facilities, we would work closely with the lead unit of the Department of Education to do both assessments, testing, and abatement of classrooms and working with them to arrange for this work that would not disrupt school and all the other logistical complexities that are involved with doing work in an active school building. And so those, I think as we move forward, we'll take a look at the way we've done those collaborations. It's relatively early on in our thought process of that, but traditionally we have consistently just started with the commissioner's order, or we've worked with other agencies that have some resources to do some of these investigations. But I don't know if that's exactly what you're asking about, but I do think there'll probably be a time where we look at the way how we're doing things and to see if we can strengthen any oversight or strengthen any policies. But we are consistently tracking and following up on all addresses that are associated with a child with an EBL.
Okay, and could you give us an example, like a sense with the Department of Education or with child care facilities? What is your endpoint? At what point do you decide, okay, this is finished?
Right. So for us, it would be submission for a child care facility. It would be a follow-up inspection to confirm that the issues the areas we identified as having lead-based paint were corrected, and that would be also accompanied by acceptable clearance dust wipe submission where we see that the work that was conducted didn't contaminate the space. For Department of Education, historically, it's been a little bit different in that they would do all of those things. They would do follow-up inspections, they would do testing, they would do the work, and they would do the clearance dust wipe testing. Not them. There are several different parties at play in that whole process, and they would report back on the status of all those different milestones to us. That's how it's been historically.
Okay, thank you.
Thank you for your thoughtful questions. And as I don't see any other hands raised, let me try to, I do see one more. Back to you, Karen.
Sorry, one last question, which I think you might want to change. One last issue on page 4, where the definition of dwelling is right above supplemental address definition. There's still a reference to blood lead level equal to or in excess of 15 micrograms. And I think that should be 5 at this point.
Right. That is one of the proposed changes that we're suggesting that is made.
Okay, but it doesn't designate it as being changed on the document. That's, just in the narrative without.
Thank you.
Yeah.
Thank you for pointing that out. I think I don't see any other questions. So let me turn to my colleagues, Christopher, and if you need an assist from Lisa, I think what we have to just lay out before we move to a vote is the changes in language between what Karen and what Joel had stated that would be made before the proposed amendments move to publication. So can one or both of you together just lay those out before we call for a vote?
I think, Commissioner, I just wanted to make sure that, I'm a little bit of a newcomer to the process, but as I understand it, if we made changes now before publication, we'd have to come back again to do the same, presentation. And the other option would be to accept right now for publication what we have reviewed and use the comments that have been made during the meeting that we've had thus far in the context of other public comments that come in during the 30-day period.
I understand. Okay, so let me just recap for how we would move forward then. We have captured the comments, including the revisions to language that are being proposed. However, we would vote on the proposed amendments as they are written currently. And once we enter into the public comment period and there are additional revisions to the language, the proposed amendments would be so revised according to what has been discussed here as well. And of course, that would still have to be brought back to the board for a formal vote.
Correct.
Okay, I see heads nodding, so I think we have accord on that process. So if there are no further questions, may I have a motion to approve for publication the proposed amendments to Article 173?
So moved.
Thank you, Joel. And may I have a second? Thank you, Karen. Okay, and I'm just going to call each name. Please respond with aye, nay, or abstain. Lynn Richardson,
Aye.
Pamela Breyer,
Aye.
Mitchell Katz,
Aye.
Rosa Gill,
Aye.
Sixto Caro,
Aye.
Susan Kletzman.
Aye.
And so with the unanimous vote, the motion carries. Thank you all for your attention, for your thoughtful questions. As always, we look forward to a subsequent conversation about this after the public comment period, of course. And I can never end without a really sincere thank you to each of you as we continue to navigate these turbulent times. I know how much you're all doing for your patients, for those of you whom are clinicians, and for your communities in our city. So on behalf of the department, I'm really grateful for that. And we stand shoulder to shoulder with you, as you know. Thank you again.
Thank you.
Thank you, Commissioner.
Thank you, everyone.